welcome to the Plenty of Positivity podcast. I am your host, Courtney Beck, and today we have a very special guest, Dr. Todd Otten. Dr. Otten is a husband, a father, family physician, co-author of Ripple of Change, and a decorated naval flight surgeon. It is my absolute pleasure and honor to welcome Dr. Todd Otten.
Well, thanks for having me. I feel like I'm blushing every time I hear some of this stuff. I'm just a guy who wants to make a difference.
It's truly incredible. I mean, the accomplishments that you have, Dr. Otten, I cannot wait to jump into this podcast. So why don't we first start off with an introduction and a background of yourself?
Oh, sure. Yeah. So, like you said, a husband, father, family physician. I graduated medical school 2002, hence the seemingly more and more gray hairs that are showing up on my chin and beard, what have you. Anywho, I thought I wanted to be a trauma surgeon. Loved the culture. Excuse me. No, I take that back. I loved operating. Did not love the culture. And I'm like, oh boy, what did I get myself into? Trained as a flight surgeon and absolutely loved it. It's like primary care. So I came back to Michigan, did my residency. And after that, most of it was amazing. I won't play spoiler just yet and go through the whole thing. But yeah, you could say I've had career 1.0, which was predominantly seeing patients, and then now career 2.0, which is predominantly causing trouble.
No, that's incredible. And I would love to start from the very beginning because I think it's always so interesting how we go into different fields or different disciplines. So did you always know that you wanted to go in the direction of medicine?
I would say at a relatively young age. I think I was probably a freshman or sophomore in high school when I decided that I wanted to be a physician and really, started dedicating a lot of my life to that purpose. And if you think about it, that's a 16-year-old adolescent young adult making a long-term career decision, not fully even understanding all the ramifications of that. I think there are some things, and I know this is about positivity and I don't want to put a negative spin on it, but in retrospect, I think some of the traumatic things that I had endured as a child, including bullying, propelled me to want to help others. And ultimately, I see that path as I feel like I've had a lot of yield in terms of positivity. I joke that I see the cup 3/4 full, not necessarily half full. And that propels me to want to do other things. But to answer the question, yeah, it was very early on. I did a Parks and Rec where I was a supervisor. And so I got to interact with the children. I always did very well in school. And so obviously that high achieving capacity was there. And I enjoyed the interaction with other human beings. I mean, when you help another human being, it's at times it's hard to describe that euphoria. And I feel like if we had more random acts of kindness, the world would be a better place just in general. So that was kind of the impetus of my career. Then into college, where I was actually a track and field athlete. I wore my alma mater shirt today. So there's the sports background there too. But yeah, that's how it started.
I always like to ask that question just to see what really propels people into their field of study or their discipline. But you also mentioned sport. I think sport has can have such a profound and positive impact. What was your experience like just in sport?
Oh, wow. So I I don't even know how to say this. I was gifted with a fair amount of athleticism. Um, that really didn't blossom until I gotten into high school. But when you think about and I don't get to talk about this too much, so maybe I'm reliving the glory days a little bit. So bear with me here.
I
But
love it.
it's not often that a 5'9", white male has a vertical leap of 35 inches and can run a 40-yard dash in 4.5. And so I was definitely a bit of an outlier on the track and field space. Um, my best long jump was a little over 22 feet. I did D1 track and field for 3 years just as a walk-on, but still I got to compete with some amazing people. And then the other thing that probably the other biggest athletic achievement I had is we were state champions in soccer my senior year. and I was blessed to be the leading scorer. However, my teammates joked that my only move was that I would kick the ball past the last defender, and I was so much faster than everybody else, I could get to the ball first. And there's probably a lot of truth to that, to be quite honest with you.
That's hilarious. No, and I do. I think we can learn so much from sport when it comes to lessons that we're able to take on to or with us in our professional career. So I'm curious, as you were going through, even in college, as you had mentioned, being a walk on and just having that opportunity at a D1 university, what are some lessons that you have been able to take forward as you had entered into more of the healthcare industry, if you will, and into medicine leading up to present day?
Oh, as we're talking about this, you have me remembering a story. And actually, I was thinking about this interview yesterday a little bit in the sports, and sort of getting excited about maybe talking about some of these quote unquote glory days or whatever. But my senior year of soccer, we had a very good team. Um, in like 23 games, I think we gave up 12 goals, which is like nothing. Um, and we got a little full of ourselves, to be honest with you. There were some egos. There were, including me, wanted to get goals, wanting to get assists, and all these other team or things rather. And so on in the year, we had played this team and we destroyed them. I don't know, it was like 8 or 9-0. And then we went back and played them at their place and we tied 0-0. And it was really a function of the lack of teamwork in that game. We were playing as individuals. And so the next practice, there were 5 seniors. Myself was one of them. And the whole team was kind of sitting on the bench waiting for coach. And a couple of the seniors, including myself, just started talking about what had happened and how we had blown that game. Like, we weren't playing as a team. We were playing as individuals. And from that moment on, we didn't lose a game. We won all of our games for the rest of the year and won the state championship. And I think about that moment of, individuality versus teamwork. And I think that definitely carried on with me into my career in medicine. In the Navy, it was teamwork. In residency, it was teamwork. I mean, I quickly learned, like, don't piss the nurses off because they'll page you all night. And not only that, they're the ones with the patient the whole time. So like they really know what's going on. So you need to make friends with them. Fast forward, I'm married to a nurse. And I think that's where actually ultimately, to maybe shift gears just a touch in the conversation, I suppose, I think that's where we're headed with the documentary. We have got all these amazing people doing wonderful things that at times can't get on the same page. And as a result, our healthcare system has gotten completely out of control in terms of where its focus is and the level of dysfunction. So I see teamwork and solidarity as key.
That's incredible. And like I said, I really do. I think the powerful lessons that we're able to take from sport into our professional careers really helps us. You mentioned individual versus like teamwork. And what's interesting, I got to experience that in gymnastics because initially it is a more individual sport, but then college becomes teamwork. So I see what you're saying with that, but I really want to dive into this documentary. Let's just go straight into it. So you are an executive producer for this documentary called Suck It Up, Buttercup, Trust and Betrayal in American Medicine. So please, Todd, enlighten our listeners as to why you are producing this documentary.
Oh, I was initially thinking of dumpster fires when you were talking about this, because that's often alluded to in healthcare. But I won't talk about dumpster fires. Maybe I'll give you sort of my why first, and then kind of how this came about, and really what we're hoping to accomplish with this. So, and forgive me if I get a little bit emotional when I talk about this, because it's not easy. I think there's really 3 components to my personal why I'm so driven to want to create this product and really, in a certain extent, I suppose, help lead the charge for change. One, I went through horrendous burnout in 2019. I mean, it was bad. You go from loving your job and being excited to see patients and help people every day to sitting in my backyard in tears, hating it. The same job, wanting to quit. It's such an awful visceral pain that unless you've really been at the depths of that hell, it's hard to describe. The other the other thing for me is, unfortunately, in my career, I've had 4 of my colleagues die by suicide, um, including a friend, including a partner, and finally addressing those things and grieving them. And I think there's some silver linings related to all those events that have occurred for sure. But the frustrations of patients too is just daily when I was seeing patients full time. So those things have really driven me to, connect with Mary Ann Wilbur, who's a good friend and a GYN oncologist. Really, this was her dream. I got involved for a few reasons: thought leadership. I have a pretty good network. Also, the fundraising component of it, if you will. Where it stands, the momentum behind this is unreal. And as you said, we really want to pull the curtain back to the American public. How greed has negatively impacted our healthcare delivery system, really at every level. The stories you hear, granted, there's a lot of amazing positive stories. I would make the case we've probably got a lot more on the other end of that spectrum right now. But on the positive or hopeful end of this, there are a lot of amazing people out there. Most people that went into healthcare for the right reasons. They want to help others. They want to make a difference. And I feel like what we're trying to create is going to allow those individuals to connect better, work together, i.e. as a team. And, back to that sports analogy. And by doing that, I think that will give us the momentum, energy, power, whatever, however you want to spin it, to really fight the status quo. The status quo is well funded, well lobbied, has been around for a long time, and is making a lot of money. And they are very happy with that. And so, yeah, that's how it came to be. And we're super excited about the project.
Oh, that's incredible. I want to take it a step back because you mentioned that you experienced burnout in 2019. So, of course, just looking at the timeline, I think that's very interesting because after COVID, I could only imagine just what that environment was like. But the fact that you had experienced it even just a little shy of COVID, could you maybe just elaborate on that? Was there particular instances that led specifically to that burnout, or was it just like big picture?
Probably more big picture. I mean, I think there was a couple moments in time that was, accelerated for me. But I think, if you look at medical training and medical education, I mean, it's almost this, sadistic intergenerational trauma that occurs. And we don't need to get into that. But that sets you up to compartmentalize, oftentimes be a lone ranger, not looking for help from your teammates and just trying to do more and work harder and all these other things. But then there's all these barriers, right? Prior authorizations, insurance barriers, financial barriers, time constraints, the list goes on and on. And when you can't help someone the way you want to help someone because of all these other barriers that you've created, that's like death by a thousand cuts. A colleague of mine, Wendy Dean, wrote an article called Moral Injury. And it's that inability to do what's in the best interest of the patient because of all these barriers that I just outlined. And I'm paraphrasing a little bit. That's what really built up to it. But then it imploded for me when I had $3,000 in pay withheld because I had 2 charts that were incomplete. 2.
Oh.
That's insane. Literally a medical assistant had to check 1 box in each chart. That's when the wheels came off the bus. I was an angry little man, you could say, who didn't know what to do with those frustrations and was ready to quit, honestly.
No, rightfully so. And I had, we spoke about this earlier, not near medicine in that capacity, but more on the sales side. So if you could just educate me, if you could change 1 or 2 things just in this conversation, like what are things that you would really work on to help this healthcare system?
Oh boy. I guess it depends on, do we want to go like big picture or micro picture? I think before I go too far into the weeds with this, I think micro picture might be the way to go with it with something like this. I think, in our culture, we're most often concerned with how things affect us. And, there's that WIFM, like what's in it for me, if you've never heard that acronym. And I think that's causing a lot of, I know that's causing a lot of problems, particularly with the doctor-patient interaction and even amongst colleagues, right? Um, so, maybe often one of the simplest things I suggest for patients even is thank your clinician. Ask them how they're doing. I mean, you literally might be there's a 50-50 chance you are sitting across from somebody who is burned out and hating their job. And by you asking them how their day is going, I can almost guarantee you're going to get more time with that clinician, to be honest with you. But you potentially could save a life. I mean, we have a big issue. Well, I don't want to digress into the dark spaces of medicine per se, but I think this goes to any industry. We need to do a better job looking out for one another. Hey, how are you doing? And it's not that we need to be therapists for one another, but that we're human beings. We're meant for connection. We're meant for compassion. And yet many times we don't show that, so do a random act of kindness, challenge yourself 5 times a day and see how it makes you feel.
No, Todd, you nailed that. And I've been thinking about that a lot. I mean, even with Plenty of Positivity, I have my 3 C's, if you will. So communication, connection, and community. And it just got me thinking as you were speaking, focusing on humanity. I feel like we're in such a rush today. I'll speak for myself at least. But it's always go, go, go. How much more can you do? And that we don't even take the time to experience how valuable, like you said, a simple conversation could be, checking in with somebody else. And so do you think that there was anything in particular, maybe even since COVID, like 5-10 years, that you've seen this transition or this change, if you will, specifically in medicine, or you could even speak just broadly that you've seen like an actual change in society?
Oh, I think there's a lot of things that contribute to where we're at in healthcare. I mean, two of the bigger things that are pointed out regularly is, and I'm not a political expert, so
Mhm.
um, don't say, "Oh, Dr. Hahn said this, he said that." Like that's not my wheelhouse. But Citizens United and how lobbying and PACs influence Capitol Hill, I think is very problematic. And then 10 years later, we had COVID. And, you talk about setting up, an institution to struggle and or fail at times. We kind of done that. I mean, medicine's difficult already, and then you apply all these other unneeded pressures on it for profit extraction. Oh boy. But I don't want to go down a dark place. I was actually going to maybe shift gears and talk about go back to the random acts of kindness. I had a story recently, and I do this occasionally where I totally derail myself, and it is what it is. And I'll just keep going. So I was with my 3 older boys at a restaurant, and a young lady came up, waitress, and I asked her how she was doing, looked her in the eye, and then I made note of her name at the time, and I won't repeat it, because we're on the air, and who knows, maybe she's listening, I don't know. But I addressed her by her name, and you could see the change in her face when I acknowledged her as another human being. Like, hey, we're all in this game together. And when she walked away, I said, "Boys, did you catch that?" I said, "Did you see what happened there in that moment?" Of course, my 3rd youngest, his focus might not be the greatest, so he didn't really catch it, but the 2 older ones did. And they're like, "Yeah, Dad, as soon as you said her name and talked to her, it like the interaction changed. You could see it." That's so simple, like acknowledging another human being. It's so simple, so easy, yet often we don't do it, right? Um, yeah, so I don't know. I just felt like telling that story. I thought it was good. Sorry.
No, I am so happy that you mention it because I talk a lot about the idea that if in fact you can be in person in anything that you're doing, to definitely do that. Because to your point, when you are able to address somebody by their name, look them in the eye, and like I said, here, like we're looking each other in the eye, but it's like different, if you will. There's something about that. Do I think technology has done wonders? We wouldn't even probably be able to do this today. And so I think it has its pros, but I think on the flip side of the coin, to really have that sense of human connection, like I said, really highlighting the value of a conversation with another human being using their name, it really does make a difference. I mean, I think about the times that somebody's addressed me as Courtney, how are you doing? It's like, whoa, you remembered my name. We only met once. Like, that's pretty cool, just like small things. But I do believe in life, it's the small things that make or can have such a profound impact on us, not the like big time events that we look forward to in life, but sometimes it's just the small acts of kindness along the way, like you had mentioned. But Todd, I have to reiterate, and I'm going to read verbatim because I do not want to miss any detail. This is incredible. You have over 20 years of experience in providing quality patient care, leading teams, and managing projects in various settings, including the U.S. Navy, where you were honored as a Naval Fleet Surgeon of the Year in 2006. Huge congratulations to you. My question to you is, during that experience, could you maybe just highlight, when we're talking about positivity, something that was really fulfilling in this role, and that when you obviously would receive this incredible award?
Oh, wow. That's an interesting story, actually. So, oh boy. So I'm at a conference in Pensacola, Florida, and, in front of all these people, and they, a bunch of other physicians, naval base, what have you. They announced who the flight surgeon of the year is for the Pacific Fleet. Wasn't me, the Marines, the reserves. I was in the Atlantic Fleet,
Mhm.
and I was named as the flight surgeon of the year for the Atlantic Fleet. And wow, I was like, oh my gosh, that's amazing, so exciting. Then they named who it was for the whole Navy, and they say my name. I get a plaque. I'm super excited, like, can't believe this. So, as a junior officer, what do you do? Well, of course, you blow off part of the conference and go play golf with your buddies and have a couple pops or beers or whatever. And so, come back the next day, and I think it was a captain, maybe an admiral, I don't remember, said, Todd, we made a mistake. You actually got second.
What?
And they proceeded to announce it to the whole conference, take the award away from me. I was mortified. I it was so bad. But the reason I'm telling this story is this. My chain of command got word of it back in Brunswick, Maine. They were so upset with what had happened. They were rattling all kinds of cages. And when they got back, they gave me I got a ribbon, Navy and Marine Corps Commendation Medal, which is a pretty big award. And honestly, getting that award from the guys and gals that I was caring for in the preceding years meant so much more than a stupid plaque that I actually got second for, although it makes a great story. So I guess that was a moment that went from what could have been ultimately a very negative situation to really a very positive situation for me. And I learned a lot of lessons related to that.
Wow.
Um, Yeah, and so I talk about it sort of tongue in cheek now again. But yeah, there you go.
Moving forward, most recently, you are a emergency care specialist in Michigan. So my question to you is, obviously this is probably an intense position, but is there something that is fulfilling in this role so far that you've seen in comparison to maybe other roles? Like, how does it differ from other roles you've had in the past?
Oh, this role is so much different. So when I stepped away from my toxic employer at the end of 2022, I had about a year off away from direct care, and I started missing seeing patients, to be quite honest with you. Emergency care specialist is an independent physician led, been around for 40 years, amazing group that really tries to do the right things and deliver quality care in a whole host of different arenas. Their chief medical officer and I have been good friends since we went to medical school together. And for the record, I sat down next to him first. He thinks it was the opposite, but I definitely sat down next to him first. Anywho, so I reached out and I said, hey, look, you guys know me. We've been connected for years. Like, I'm missing seeing patients. I know you guys do things differently. I'd like to work part-time. What can we do? And so they took a chance to hire me on. And I do a little bit of direct care in what we call complex disease management, where if somebody's struggling to navigate the system or they can't get the right diagnosis, they can come in and see me. I'll spend an hour and a half with them, dig way into it, and send them out with what I think is going on in a good game plan. And for those that have taken advantage of it, I think the vast majority of them have gotten quite a bit of yield out of it. But the other thing is the group allows me to do all these other amazing things, like be on podcasts and do interviews and work on a documentary and networking. And so I brought some unique, different projects back to the group, and more to come. And so it's not a traditional role. There's definitely a risk that was taken by the group to allow me to do this. But I think ultimately, as we get further and further into this process, it's going to be seen as a win for the group at large. In fact, one of the things they're doing is called the Right Care Clinic. And I'm not trying to do an infomercial here, but I think it's amazing what they're doing. They've taken, if you think of a traditional notion of an urgent care and then the ER, there's a big gap in terms of care, right? And so they created a clinic that is staffed by an ER physician, has an ER nurse, X-ray, CT, labs, IV fluids, IV medications, EKG, so on and so forth, but no facility fees. So you can get near ER or ED level of care without getting this massive freaking bill. And it's starting to take off. And so then I think some of my connections might be interested in helping us scale this project because it benefits not only the group, but really it benefits patients. Like all of a sudden you've got this amazing resource, and it's not like you're going to no offense to urgent cares, but a lot of times they're just Band-Aid situations. I mean, the ER docs they're taking care of sick people and sending them back home to follow up their primary care as opposed to being admitted into the hospital. It's just incredible. So positive.
Wow, that's so fantastic. I have to ask you this as you were speaking. I was so curious to understand, to be able to implement like any type of innovative idea in medicine. Is that because you were able to do this because you know these people, or how often is it that you can present an idea and actually follow it through with implementation? Is it difficult, or is it actually easier than probably what I'm thinking?
Well, first, I don't necessarily want to take credit for the Right Care Clinic. My role in the Right Care Clinic is small. There's some, this is the brainchild of a buddy, Dr. Todd Chassis. And is it easy? Oh my goodness, no. Oh boy, like you talk about insurance issues and third-party payer issues and marketing. Like if you think of an ER group, you don't have to market in the ER. People just come. So when you create another entity, you've got to market for it, and that was definitely a learning curve. So is it easy? No. But is it rewarding, at least in my opinion, playing a small role in this? 100%. And to see patients get amazing care at the appropriate level because somebody took a risk, I think is incredible. And ultimately, that's what we need now. Like in many places in the United States in healthcare, it is not working. Like full stop, period. Like literally people are dying. Like
Mhm.
we have got to try different things. And it takes courage. It takes courage. It takes resources. It takes guts, and this group has it. And so I'm thrilled to be there playing my small part in the process.
No, that's incredible. And that's something I noticed, Todd, as I was doing my research, just with your background, is when you see either a challenge or a problem, you take action. And I think that's admirable because a lot of the times, just kind of speaking about ideas, we could have ideas or we see that there's a challenge, but what are we going to do about it? And that kind of segments into, you are also a co founder of our Quadruple Aim. Could you maybe elaborate on that for listeners as to what that actually is?
Oh wow, yeah. So our quadruple aim is an evolution, if you will. The triple aim came out, I want to say, about 2007 from the Institute for Healthcare Improvement. Don Berwick was one of the key originators of that. I've been blessed to meet Don, be at his house, interview him. I was like transported to nerd heaven that day. It was amazing. I had him sign my laptop. I was so excited. Um, and then I had to shellac it afterwards. Oh my God, am I derailing myself? So anyway, fast forward, I think people realized that we were missing something with the triple aim. And even Don would say it too, like that clinician wellness piece was missing. So the original thought was around population health, and I'm oversimplifying here, with patient experience, quality care, and lower costs. So that was the triple aim. The Quadruple Aim includes wellness, whether you use the word clinician, physician, we use the word provider. But I still felt like something was missing. Like I felt like there's all these marginalized groups out there and people that are underserved or uninsured.
Sure.
And so Joshua, my co-author, who was one of my patients, we talked about it and we decided to put the word our in front of it. So we called it Our Quadruple Aim. Not mine, not Joshua's, not yours, but everybody's. And so it's patient experience, quality care, lower cost, provider wellness, but with that overarching theme of health equity. And really it's intended to be a lens, like, or a framework, like when you're making decisions in the healthcare space or really any space, like not just the ROI, but how does this affect human beings?
Mm-hmm.
How does this affect the overall total cost of care? And the reality is when you use that framework, the vast majority of people win, and you're usually busting at the seams with patients and people get good care. And really, I would like to see that notion scaled. And that's part of the documentary. I mean, ultimately, the documentary is more about teamwork and collaboration and solidarity, but you have to have a framework then to move forward. And whether it's the quadruple aim or our quadruple aim or the quintuple aim, pick one. I don't care. But value your other human beings when you're making decisions, not just the almighty dollar.
No, I think that's wonderful. Just raising awareness to that and adding on, like you said, to pre-existing frameworks as well to just help the healthcare system in general. In addition, you just kind of mentioned it too, but you are a co-author of the book Ripple of Change. So, what made you write that book alongside, obviously, the other author at this point in time when you wrote it?
The first driver for that was having gone through burnout.
Mhm.
Um, and it really took probably about 2 years to recover from that. Um, so I started writing. I wrote a poem called "Medicine is a World of Gray," which is kind of a dark look at primary care. From there, I wrote a chapter called "Anatomy of Burnout." Really, how does one physician being burned out impact really thousands of people in not such a good way, right?
Mhm.
Um, and then Joshua Judy got involved because he was struggling with his healthcare, really as a result of a script I wrote for him. And I was looking for other ideas to try and get him out of the dark place that he was in. And maybe two interesting tidbits to that. I think one was the catharsis for not only Joshua but also myself in the process.
Mhm.
Um, but in our conversations, I told him at one point, Joshua, I believe you can get better, but you have to believe it too. And I think it was that connection that wasn't the whole thing, but that was at least a piece of him starting to come out of a deep, dark place. And ultimately, the book, with the book, we're really trying to inspire everybody to play their part. The landscape in this country in regards to healthcare and really many other things needs a lot of work. But if we all sit back and say, I'm only one person, what can I do? Nothing's going to change. Nothing's going to change. But if you do something, anything, support an organization you think's doing good work, acts of kindness, reaching out to another human being, acknowledging another person, I don't know, pick something. If everybody did that every day, man, would we be in a different place, as opposed to where we're at now. And so, there's obviously the analogy and the metaphors from throwing a little pebble into the pond to becoming ideally a tsunami of change is what we're hoping for.
No, that's fantastic. And all of these titles, I think it's unbelievable the titles that you have held and just a very, very successful career. But I always like to ask guests, how do you like you said you have three sons, your wife is a nurse too as well, and how important family is in all of this, helping you maybe navigate those difficult times, those challenges. So I'm going to open up the floor just for you to speak about just the importance of family and how they have helped you along the way, or perhaps what lessons they have taught you.
Oh yeah. Okay. So, well, and I can't forget I do have a daughter, Natalie, too, and if it didn't include her in the mix, I would be in big trouble. And we have a big fish tank full of fish.
That's
Um,
mentioning
no, don't worry. It is what it is. Like, my goodness,
not
there's all
only
kinds of stuff to talk about. But um, I think what I'll focus on maybe a little bit is kind of coming out of the darkness a little bit. So as physicians, we are trained, and even in this is the same in the military. You're brainwashed a little bit in terms of compartmentalization, and particularly in medical school, you're trained very well to stuff things into a box. I got very good at stuffing things into a box. Anything that was negative, deaths, losses, whatever, into the box it would go, and rarely was it ever addressed. That box got opened up last summer, and it was difficult. It was very difficult at times. And even still, it's not perfect, but the key to recovery from whether it's trauma or abuse or grief or loss is connection. I often say connection mitigates trauma. And so the connection with my wife, with my kids, with my teammates, with my colleagues at work, those connections have helped me heal over the past year and a half, and move forward. And I think also propelled me to really drive this documentary forward, that we're working on. Um, so yeah, they're critical. I mean, they're imperative for sure.
No, that's wonderful. And with regards to the documentary, could you provide listeners more, perhaps details as to when it's going to air and how they can maybe see it?
Oh, sure. Yeah. So, um, we are in the process. We've got several screenings coming up that will be sprinkled throughout the months of August through November, of 2025. And who knows when this will be released, so I'm trying to keep that in mind. Those are going to come fast and furious. I'm having people from all over the country say, "Hey, can we do a screening here? Can we do one in LA? Can we do one in the Northwest? Can we do one in Philly, New York, all over the place?" So we will populate our website with that information, and the website is suckitupbuttercupfilm.com. And you can always look me up on LinkedIn, and I'm pretty responsive. But really, where we want to go with this is way beyond screenings at academic institutions and medical schools and these other places. We do have a plan for getting this into potentially some film festivals. I'm not going to say which ones. I don't want to screw things up because that's not my role in this. But ultimately, we would like to get this onto a streaming service, because we feel like the more people in the United States that can truly understand and appreciate what's happening, the more of those individuals can then be activated and then participate in solutions as we go forward. So hopefully we can get it on a streaming service, and I'm not going to name names because if I don't want to piss one off and then the other one offers us a contract or whatever. But that's really where we'd like it to land ultimately.
That's incredible. And I do have to ask you, what is next, Todd? Is there anything that you've been really either striving for or something that's been on the top of your mind? I mean, you already have accomplished so much, so I can't imagine, but what's next, Todd?
Well, and I realize I didn't definitively answer your question too, so I'll definitively answer the last question and then I'll get to this question. So the definitive answer, we think we're going to have a finished product in November. And then hopefully maybe Q1, Q2 of 2026, this gets onto a streaming service. What's next for me? I think it'll be interesting, where I'm at right now. I think people appreciate the fact that I wear my heart on my sleeve. I think people appreciate the vulnerability. I think that people appreciate the fact that I acknowledge I'm not perfect. I've made mistakes. I think there's going to be some speaking engagements that come as a result of this, which I enjoy. Ultimately, I kind of see myself as a bit of a catalyst, in terms of facilitating things and the stick-to-itiveness of it and getting things to the finish line. Like I never in my wildest dreams thought I would be helping to produce a documentary that I think is going to have massive impact. And somewhere along the line, I learned to be naively fearless, at times. Like, I may not know all the answers, but I'm going to give it my best. And if my best isn't good enough, then so be it. So I don't know that I have a specific thing. I am working on book number 2 because I love to write, and that'll come out hopefully next year. But um, I see myself being involved in some capacity with continuing to try to move the needle forward because um, we can't keep hurting patients and clinicians at the rate we're doing it. We just can't. And I want to be a part of the way forward. So see where it goes.
No, it's truly remarkable. And like I had mentioned, I really do like when I was doing my research, what you have been able to do as far as take your experience and translate it into something positive, as you had mentioned, experiencing burnout in 2019, but looking at the healthcare system and making that change through that movement, our Quadruple Aim, a documentary, writing a book alongside a patient. I think that's absolutely incredible. And like you said, talk about a positive catalyst forward. That's you, Dr. Otten. So I would love to round out this podcast with a positive note, if it's a quote or perhaps a phrase for our community.
Ooh, there's so many things to choose from here. There's actually I got something. I'm gonna do a little bit of spoiler here. I'm gonna read a quote from know exactly where it is. Give me a second here.
Absolutely.
Sorry. Thank God for editing, right? So this is the book, by the way, for interesting. I used to pick it up all the time, but now I tend not to, I suppose. All right, so this is from T.S. Eliot, and this is near the end of the book. What we call the beginning is often the end, and to make an end is to make a beginning. The end is where we start from.
And what does that quote mean to you in your life?
When a physician steps away from full-time care, it's often very difficult because your identity is so wrapped in that being a caregiver and helping other human beings. And to a certain extent, I felt that when I stepped away from full-time clinical care. But I also thought, you know what, as one door is closing, another one's opening. I don't know what's on the other side, and I could have been afraid and not walked through it. But I felt like I still have gifts to offer. I still have things I think I can do. And so I walked through, not really even knowing where I'm going. And here we are now. And I think that circles back to your last question, like what's next? Like, when the documentary's done and is out there and distributed, doors are going to be open, and I'm hoping the good Lord helps me figure out which one to walk through.
This is incredible. Like I said, just everything that you have accomplished. It's truly inspiring how you have moved forward to really make a large impact on healthcare. And it's been an absolute honor to have you on this podcast, Dr. Otten. And I wish you the absolute best, not only with this documentary, but as you move forward. I know that doors are going to open for you. So I do wish you the best.
Oh, thanks. And thanks for having me. This was an absolute blast. I had a lot of fun.